Hello everyone, welcome back to Healing Her Sacred Light. Today, as you can see by the title, we're going to be discussing a topic within our Womb Attacks series, and that is obstetric violence and birth trauma. This is a critical and often overlooked issue in maternal health care. This video aims to bring to light the challenges many women face during childbirth in hospitals. Birth is meant to be a sacred and transformative experience. Yet for many women, hospital-based maternity care can lead to physical, emotional, and psychological trauma. Hopefully this video will raise awareness and spark necessary discussions. Let's get started. So first, let's start with the definitions of obstetric violence and birth trauma. So what is obstetric violence? Obstetric violence is a physical, sexual, and verbal abuse of pregnant and laboring women by medical staff, including nurses, doctors, and midwives. What is birth trauma? Birth trauma refers to the psychological distress experienced during or after childbirth, regardless of whether physical harm occurred, and can be a result of obstetric violence. It's important to recognize that just because your baby comes out healthy, it doesn't negate the possibility of a traumatic birthing experience. So let's go ahead and dive into some statistics so we can understand how common this is. So the World Health Organization reports that more than 1/3 of women globally experience some form of mistreatment during childbirth in healthcare facilities. In the United States, approximately 45% of new mothers report experiencing birth trauma. According to the American Psychological Association, about 1 in 25 women develop PTSD, that is, post-traumatic stress disorder, following childbirth. Another stat, over 50% of birth workers, and that includes doulas, childbirth educators, and labor and delivery nurses, have witnessed physicians performing procedures against a woman's will. Many women report feeling forced into C-sections, subjected to bullying, coercion, and unconsented procedures such as episiotomies and vaginal examinations during birth. So for those of you who watched my first video, I mentioned that I wanted to go into obstetrics and gynecology. And that is because when I witnessed my first birth on my OBGYN rotation as a third-year medical student, I was in absolute awe of the sheer power and wonder of the female body. Truly, giving birth is a moment of pure magic, and it's a sacred transition where a woman becomes a mother and a new soul enters the world. I actually cried during my first birth. It was just such a beautiful experience. But amidst the beauty, I began to see the unsettling realities of hospital-based maternity care. Instead of being honored and empowered through the birthing process, many women were subjected to rigid hospital protocols that prioritized efficiency over their well-being. So let's go ahead and talk about it. First, we're going to dive into some examples of what could happen. So, rushed labor. Women were rushed through labor, either by inductions or by being forced to push before their body is ready. And why were women rushed? Well, because childbirth in the hospital is a factory. Get them in, get them out, get them in, get them out as quickly as possible. So if your birthing process wasn't going fast enough, they would just induce you with Tocin or artificially rupture your membranes. And if you really took too long, they'll just take you back for a C-section. You see, labor that takes too long disrupts their schedules, shifts, and room turnover. Inductions and surgical births are easier to schedule and control. And some OBs may even encourage interventions just to avoid working overnight or on weekends. So birth was just a factory line, not a sacred process. And the thing with the Tosin and the epidural, it's like, so while epidurals they don't stop contractions, what epidurals do is they reduce movement, they numb the body, and they therefore make labor longer. You see, when it comes to labor, utilizing gravity is very important. In fact, in a lot of indigenous practices, like in Africa, the women squat. So they're in a vertical position. And so when you're in a vertical position, the gravitational force of Earth is pointing down, right? You're utilizing that gravity to help push the baby out. But with an epidural, because it's literally numbing your body, your lower half of your body, you can't utilize gravity assisted positions, and this could make labor progress slower. Not to mention, epidurals reduce the urge to push sensation. So if you don't feel that urge to push, it's hard to effectively push the baby out. Then when labor slows, the doctor may add Tosin. And Tosin creates strong, rapid contractions, and these contractions can stress the baby out. And then that's when fetal distress happens, right? And then an emergency C-section follows after that. Stronger contractions can reduce blood and oxygen flow to the baby, and that's what Tosin can cause. And this, like I said, increases the risk of fetal distress, and that leads to emergency interventions. In fact, babies born after high-dose Tosin may need NICU monitoring. And the NICU stands for Neonatal Intensive Care Unit for those who don't know. So it's basically like, because of their interventions, now you're having all these emergencies, emergency interventions, emergency C-section, your baby's ending up in the NICU, all because of what they did. So it's like, because of these interventions that the doctors these drugs that the doctors are pushing on laboring women, they could lead to emergencies. So it's like, once again, like I mentioned in my first video, they created the problem and now are claiming to be heroes. Oh, we're going to take you back for a C-section to save your baby's life. And it's like, the interventions you guys did kind of contributed to this in the first, so that's just something important to understand. On the other hand, many women were told to not push when they wanted to push because the doctor was not in the room, which is an incredibly uncomfortable experience because you're going against the natural rhythm of your own body, and that can be very distressing. I remember a woman was in labor, and this was her sixth child, and the resident I was working with, she told her to hold the baby in and to wait because the doctor wasn't there. Well, guess what? That baby slid right on out with such ease. It was just so effortless, right? The baby just slid out naturally. Well, the resident, she got upset at the woman. Isn't that crazy? She was annoyed that the woman didn't hold her baby in. It really didn't make sense. And so it's it's less about what you and your body naturally want and more about what is best for the doctors and the nurses. Another thing, the dismissive attitudes. One male doctor I worked with basically said that the length of a woman's birth plan is directly proportional to the rate in which she is getting a C-section. So basically, if you come in with this long birth plan and you're trying to basically dictate how your birthing process is going to go, basically they're basically seeing you as difficult, and they're going to override your choices. See, modern obstetric care too often strips women of autonomy over their own births. A lack of verbal consent before vaginal exams. Many women experienced unauthorized touching. As a medical student, I remember we learned before giving a vaginal exam, we were supposed to put our hand on the woman's thigh and say, "Do you feel my touch here?" and communicate to the woman before you perform a vaginal exam. Unconsented interventions, which come with risks, potentially leading to complications that only further harm the mom and the baby. So what are these unconsented interventions? Episiotomies. Episiotomies used to be routine standard of care, but guess what? they're no longer recommended because they can lead to serious complications. And for those who don't know, the episiotomy is when they basically they cut down into your perineum to open the passageway for the baby to come through. Also, some women undergo forceps or vacuum extractions, which can cause severe pain and long-term injury in the baby. Yet they are often used without explaining the risks. And I do want to say the use of forceps or vacuum assisted delivery, they are rare. I think I read that forceps are used in 0.5% or fewer of vaginal births, and vacuum assisted delivery, the vacuum is used in about 2.5% of births. So that's not a lot, but here's the thing. Last year in the news, there was a doctor that apparently tried using the vacuum on the baby's head like 15 times. It kept popping off or something, and then ultimately the baby died the next day. And the thing is the doctor ignored the woman's request for a C-section. I don't know the full details of exactly what was happening during her labor process, like, you know what I mean? But in the article, it said that she did request a C-section. He ignored her and continued to try to use the vacuum, and then the next day the baby died. Unplanned C-sections. You know, technically you have to consent to the C-section, right? But the thing is like when you're under pressure, it's really hard to make a informed choice, because basically they'll say, we have to do this right now or your baby could die. That high pressure language shuts down critical thinking and pushes women into fear-based compliance. And C-section is a major abdominal surgery with risks like infection, hemorrhage, and complications in future pregnancies. Furthermore, C-sections can disrupt bonding, breastfeeding, and emotional recovery. And with C-sections, they can seriously limit your ability to have a vaginal birth in the future. And it's not necessarily because your body can't do it, but it's because the medical system often won't allow you to try. And many women are pressured into repeat surgeries even when a vaginal birth is completely possible. There are many hospitals that discourage or outright refuse women the option of a vaginal birth in the next pregnancy. There are some providers that pressure women into repeat C-sections without discussing VBAC, which stands for vaginal birth after cesarean. For those who don't know, vaginal births are superior in many ways, which I will talk about in another video. Beyond the physical toll, emotional and mental trauma is just as devastating. Many women describe feeling powerless, unheard, and out of control during labor. Fear, abandonment, and emotional distress are common when their voices are dismissed, their choices ignored, and their intuition invalidated. Some are shamed, ridiculed, or made to feel inadequate, leading to lingering emotional wounds long after childbirth. Verbal abuse. Verbal abuse from healthcare providers, whether through shouting, scolding, or humiliation, is a horrifying yet real experience for many laboring women. Birth plans, like I mentioned before, are often disregarded, stripping women of the ability to make informed choices. Privacy is frequently violated. I'm inserting this clip because I forgot to make this point. But speaking of privacy violations, I remember that some of the women's doors would be left open. There would be multiple men in the room, men from, I guess, this tech, this nurse, this resident, this person. And it just seemed like there were crowds of people in the room. And I was like, this is very violating. Like, you're so exposed, right? As you're giving birth or just in the labor process. And it's just deeply violating to just have so many people in the room. And that's overstimulating. It creates a very stressful environment. And the woman's body should be relaxed during labor, because when you are relaxed, that actually helps release oxytocin, which facilitates the contractions to help with labor. But when you're stressed and you're on edge, right, and you're not comfortable and you're scared and you're nervous and all these negative feelings, right, that can prevent oxytocin release, and that can that could slow the progression of labor. and requests for help are sometimes dismissed, leaving women feeling abandoned in their most vulnerable moments. Baby separation. In those first moments, the golden hour, a mother's body is quite literally designed to regulate her baby's heartbeat, temperature, and breathing. Separation interrupts bonding, disrupts breastfeeding, and can create deep emotional distress for both mother and child. In hospitals, the babies are often taken away for weighing, testing, cleaning, or injecting them with all these shots straight out of the womb, sometimes without asking. The financial burden. So, with insurance, vaginal birth costs $1,500 to $3,000. With insurance, C-sections cost $2,500 to $4,500. Natural birth has become a monetized process. And the more interventions used, like inductions, fetal monitoring, vacuum forceps, epidurals, the more billable codes the hospital can charge for. So, what are the lasting effects of birth trauma? Birth trauma can leave deep and lasting effects impacting a mother's emotional well-being, physical health, relationships, and overall mental state. Emotionally, women may experience feelings of shame, inadequacy, anger, and anxiety, struggling to process the distressing events of their labor and delivery. Mental health issues such as depression and emotional detachment can emerge, making it even harder to find joy and connection in early motherhood. In more severe cases, birth trauma can lead to postnatal PTSD, marked by flashbacks, intrusive memories, avoidance of triggers, hypervigilance, and emotional numbness. These psychological wounds often manifest physically, resulting in panic attacks, poor sleep, and nightmares that continue long after birth. The strain extends beyond the mother herself. Many women find it difficult to bond with their baby, or may even experience avoidance behaviors as a result of their trauma. These effects highlight the critical need for compassionate, trauma-informed care that prioritizes the emotional and physical well-being of mothers during and after childbirth. So, how do we address birth trauma? Well, there are multiple ways. The first step is reforming the system. The relationship between healthcare providers and patients must be based on trust, respect, and clear communication. Informed consent should be a non-negotiable standard, ensuring that every woman fully understands the risks and benefits of any procedure before it is performed. Hospitals and birth centers must also honor women's birth plans and preferences, fostering an environment where mothers feel heard and supported rather than coerced and dismissed. Creating a more private, comforting space for laboring women can further enhance the birthing experience. Honoring the female body's natural wisdom and allowing movement-based, gravity-assisted positions can make a profound difference in reducing labor complications and unnecessary medical interventions, ensuring a safer, more empowered birth experience. Another important step is empowering women to reclaim their autonomy. True empowerment means giving women the confidence and knowledge to speak up when their choices are being ignored or overridden. Hopefully, by raising awareness, women will be empowered to protect themselves by recognizing poor treatment and advocating for themselves in medical settings. Another option, and this one is my favorite, to encourage home births and alternative birthing options. This is another powerful way to shift the narrative surrounding childbirth. I personally, if I ever have a child, I would like to do a home birth because this allows women to labor in an environment that feels safe, supportive, and free from unnecessary medical interference. Home births and alternative birthing options are so important because in a home setting, women can labor in positions that work with gravity, they can move freely, and birth in an environment where they feel relaxed and in control. You should be relaxed when you're giving birth. While medical interventions can be life-saving when truly necessary, like I mentioned in my first video, I acknowledge the need for emergency care. The reality is that over 50% of C-sections performed today are medically unnecessary, often driven by hospital protocols, convenience, or fear-based practices rather than genuine medical need. So, in conclusion, Birth should be an intuitive, empowering process where women have complete control over their experience. It's time to reclaim the sacredness of childbirth and ensure that every mother feels respected, supported, and heard. The modern obstetric system has normalized interventions over intuition, control over consent, and profit over patient-centered care. As more women come forward to share their birth trauma stories, it is clear that a radical shift is needed, one that honors the body's wisdom, respects the mother's autonomy, and restores birth as the sacred process it was always meant to be. Have you or anyone you know experienced obstetric violence and birth trauma? Please share your story in the comments below. Thank you so much for watching. If you found this video informative and empowering, please give it a thumbs up, share it with others, and subscribe to Healing Her Sacred Light for more content on women's health and empowerment. Together, we can create a safer, more respectful birthing experience for all. Take care. I'll see you in the next video.